CYC is a free channel that presents the Word of God for everyone. Your support will help us to continue the mission. Visit our website, cycnow.com. Even $1 will make a difference.
Hello and welcome back to our new season of CYC MD. Previously, if you recall, we met with different healthcare professionals and providers, all of whom gave us insights into their careers as well as schooling and education. In this new and exciting season, we are indulging and digging deeper with our doctors into their focused area of expertise. With me today, I'd like to welcome Dr. Heidi Marzouk. Welcome, doctor. Pleasure to have you.
Thank you for having me.
Who is our ENT specialist who works at North Shore, Long Island Jewish Hospital, and is also an associate professor at Hofstra University. Welcome again. And I know your schedule is very busy, but thanks for taking time out to be with us.
No, thank you for having me.
So I know last time we met, we talked about how to keep our ears clean. And we said that the ear itself produces this wax. And we said that a way to not clean your ear is to use that Q-tipping method that people always assume that if, in order to clean my ear, let me get a Q-tip and start cleaning. And you said Q-tipping is not the correct method.
Not ideal, yes.
Not ideal. So can we just revisit that question, and if you could just remind our viewers, what is the most optimal way to clean our ears in regards to the wax buildup?
Sure. So typically our ears clean themselves. Our body makes wax. The wax does have a purpose to protect the ear canal, but sometimes we make a little too much and it doesn't come out the way it's supposed to, just with normal showering and things like that. Basically, putting anything into your ear, like a Q-tip, or some people put tissue paper. I've even seen bobby pins or things like that into the ear, is not an ideal way to do it because you don't see what's going on. You can actually push the wax deeper. You can hurt yourself by causing cuts in the ear canal. I've even seen people puncture their eardrum by doing things like that, and you can actually induce an infection. So the more ideal way to kind of help the wax move out of the ear on its own is with softening agents, either with mineral oil dropped into the ear. Sometimes I recommend a half peroxide, half water mix. And also, Debrox that's sold over the counter. Keep in mind, if you have a hole in your eardrum, I wouldn't necessarily put these things into the ear, but if your ear is otherwise healthy, those are great ways for the wax to soften and kind of come out on its own. If, even with those things, you still feel clogged and the wax is not coming out, you could always have it cleaned by a doctor.
Okay. So now I've gotten this before, and I know it's very painful. What causes, or how can someone get an ear infection?
So an ear infection can happen just like you get any cold or any other infection. It's less common in adults because we tend to have a better drainage system for the ear than kids do. And as we get older, the drainage improves from the ear. Basically, just like you can get a bacterial infection in your nose, in your sinuses, it can travel into the ear as well because the same type of skin that's lining your nasal cavity, you have a similar skin that can get infected and produce pussy mucus within the ear as well. And the problem why it's so painful is that because when this happens, you get a lot of pressure within the ear, and that's actually what's causing the pain, is that retention of fluid leading to a lot of pressure buildup in the ear. And if that pressure gets really severe, you could actually puncture the eardrum and you could see stuff leaking out of the ear. That tends to be one of the more painful experiences.
So other than feeling that pain in your ear, what are other signs that someone would say, hey, I think I'm getting an ear infection, or I feel that my ear is starting to get infected?
So the clogging, meaning a hearing loss in one ear or both, pain, fever, and a lot of times you'll have an associated upper respiratory tract infection at the same time.
Right.
as the ear infection. In children, that's not necessarily the case, but in adults, that tends to be so.
So what are some treatment options you would say for an ear infection?
So sometimes people will run to the doctor for antibiotics as soon as they have a twinge of ear pain. Not all ear pain is an acute ear infection, but even if you do have an acute ear infection, whether it be adult or child, you don't necessarily have to treat it right away with antibiotics. Sometimes it can resolve on its own. However, if you have symptoms for more than a 5-day period, it might be a good idea to get antibiotics on board to help treat the infection. Or if the pain is very severe, you want to start the antibiotics on the earlier side. If you don't puncture the eardrum, oral antibiotics are the way to go. If you have punctured the eardrum, and a doctor sees that, they might recommend antibiotic drops as well. In terms of the pain, to relieve some of that pressure that's on the ear, you might want to try using over-the-counter decongestants for a 3 to 5 day period in order to kind of open up the drainage pathway between the ear and the nose to help alleviate some pressure.
And just to touch over that, you had also mentioned in our last episodes, as far as OTC, over-the-counter
Yes.
decongestions go, you don't want to use it for prolonged periods of time,
Right.
which is more than 5 days would not be considered
Right.
very ideal
Right.
for using that.
And also, if you have certain other medical problems like high blood pressure or propensity towards palpitations in the heart, also you want to be cautious using those medications.
Okay. So as far as the pharmaceutical world goes for ear infection treatments and antibiotics, for a person with no allergies or anything that can eliminate certain classes of medications for them, what would you say would be the first line treatment for an ear infection?
Oh, there's a slew of antibiotics you could use for an ear infection. Anything in the penicillin family, the common names we hear, amoxicillin, Augmentin is another brand name we hear. Zithromax can be given to. And then things in the cephalosporin family like Omnicef, Suprex, those are all common names we hear in terms of antibiotic treatment for ear infections. And they can go from weak to strong. And really, it's partially, what you've had before and doctor preference in terms of what's given.
So how would someone prevent an ear infection from happening? Or is it preventable?
Sometimes it's not. And if you're getting sporadic ear infections here and there, it's not a recurrent or chronic problem. It's a normal thing that can happen to anyone. But in general, I say a healthy nose usually correlates to a healthy ear because they're connected. So if you have a tendency towards a lot of nasal congestion, if you have a tendency towards allergies, if you have a tendency towards just the ear drainage pathway not functioning, either through big adenoids or other problems, sometimes when you address that, the ear health tends to improve as well.
What causes hearing loss?
Hearing loss can happen from a multitude of causes, each one of which we could spend a lot of time on. But in general, there are two big categories of hearing loss. One is what's called sensory neural hearing loss, where there's a problem in the nerve pathway between the ear and the brain, okay? And the other one is called a conductive hearing loss. And that's basically a problem with transmission from the outside, where the sound is in the air, to that nerve, okay? We know that we have an eardrum. There are 3 little bones in the ear, right? You can have the ear full of fluid, all of which can block the transmission of sounds from the ear to the nerve. So those are the two big categories of hearing loss, and they both have different causes for why you can lose the hearing in either. And let me begin by saying that any sudden hearing loss is considered an emergency. So if you're gradually losing your hearing for years, for you to go see the doctor is at a convenience level. But if you feel that there is an all of a sudden drop in your hearing, that could be something called a sudden sensory neural hearing loss, and you should see the doctor right away within a 72-hour period, because the treatment options kind of are much more limited once you've gone through that window. So that's just my one caution to the viewers. But in terms of those two main categories, sensory neural hearing loss can either be something you're born with or something you develop over time. And conductive hearing loss can be the same. And both have different causes and different treatment options.
So as far as, I know you said you just mentioned the sensory neural hearing. But as far as younger kids that are just born with, poor hearing, or they have trouble hearing.
Yes.
And the differences between an older person who just, their hearing eventually degrades as they get older. How would you deal with those two different individuals?
So when I have a child that comes in, either, in New York we have newborn hearing screening, so all the babies that are born in the nursery get screened for deafness or hearing loss. If I have a child that fits into that category and fails their screening, or is having speech delay, or the parents are noticing things behaviorally that the kid's not hearing properly, those kids I treat kind of in a different pool of thought process than adults. So basically we start with, taking a history, family history of hearing loss. We do a physical exam and we look at the eardrums. A lot of times the kids will have fluid in the ears and that's causing hearing loss. And sometimes we don't see any fluid in the ears. The way to kind of also flesh this out is by getting a hearing test. And once we do the hearing test, sometimes they can tell us whether or not it's sensory neural or conductive. Although with smaller babies, that's harder to do, and we have other methods of testing the hearing. If I find a kid has a truly sensory neural hearing loss and it's not due to fluid or some other conductive source, if they have sensory neural hearing loss, I tend to initiate some testing done to see what the cause of hearing loss is. Sometimes it's just a genetic problem, and there's nothing else associated with it. But there are other syndromes or other things that can be associated with the hearing loss, such as problems in the heart, kidneys, etc., that I want to make sure the kids don't have. So we kind of go from there. And if it is a sensory neural hearing loss, really amplification through a hearing aid or FM unit at school is possible. And if they truly have profound hearing loss in both ears, they may be a candidate for something called a cochlear implant.
Okay. We're going to actually touch over a lot of these things that you just mentioned.
Sure.
But we're going to stop for a short break, and we'll be right back. Welcome back. We are back with Dr. Heidi Marzouk in regards to our topic and discussion on the ears. So, in regards to adults, how can an adult pick up the fact that their hearing is decreasing or is becoming a little poor?
Sure. In younger individuals, it tends not to be as big a problem unless you have a lot of noise exposure. However, in adults, as we tend to enter middle age or older, we can start to pick up that there is a slow decline in the hearing. Ways that a lot of my patients notice it is if there's background noise in the area, they have a lot of difficulty understanding conversation. So if they're in a restaurant or they're in a crowded room, that becomes an issue. If you have trouble differentiating words when people are face-to-face with you, unless they're face-to-face with you, that can be a sign that things are going on. The people around you are actually very perceptive in terms of your hearing loss too. Usually, the family will start to complain, the TV is too loud and things like that. If that's the case, you might be starting to have signs of hearing loss, and it's not a bad idea to get checked out and have a hearing test done. If the hearing is normal, you've proved them wrong. If the hearing is abnormal, there's things you could do to help yourself, especially when it becomes a social issue. People tend to want to get help for the problem.
So now, in regards to hearing aids,
yes.
So those hearing aids aid you in hearing. How do hearing aids work?
So the typical perception of a lot of, my grandmother's generation of hearing aids, it's this bulky thing that hangs on your ear. It's very obvious to everyone. It makes all these hissing noises and it's very uncomfortable. And a lot of people were turned off by it. Today's hearing aids are much different, okay? The way it works is, of course, there's a microphone and then there's amplification. Mm-hmm. But now with higher end digital hearing aids, you can actually program the hearing aid based on your hearing test. So the areas of sound where you have the decline are the ones they amplify. They don't amplify everything. So the sound is much more even. Also in terms of social stigma, there are patients who I don't even know have a hearing aid until I actually look into their ear. if I don't ask. That's how tiny they can make them now. They can make them with discrete wires where it fits behind the ear. So they're not as bulky or showy as they have been in the past. And now even they have different settings on the hearing aid where you can program it if you're in a theater or if you're in a TV mode or things like that, so that you can adjust the hearing aid to the setting you're around to get better results from it. So the way they work is very complex, but they've become much more tech friendly as time has gone on.
Which is also good because a lot of people feel embarrassed, you know, when they have to wear that hearing aid. It makes them stand out. And a lot of times, I mean, I know one of my friends used to try to avoid wearing it, which she was doing herself a disservice.
Sure.
But it's great that these technological advancements have been put into place where, you know, you could just hide it. Could just be something that you could put in and really only visible when you step up
Really
close.
look.
Yeah,
Yes.
and you focus. And
I can tell you they're much less visible than the Bluetooth we wear when, you know, we're talking on our cell phones. And even when I have like children, you know, who need them, they get them in all sorts of cool colors and designs. You know, it doesn't hold the stigma that it used to.
right. So what other procedures or equipment other than hearing aids are also available?
So hearing aids is the bulk of what we use for people with age-related hearing loss. But if you fit into the category of conductive hearing loss that we talked about previously, there tends to be ways to reverse it surgically. And so the best thing to do is when you get your hearing test, you know, kind of flesh out if it's sensory, neural, or conductive, and see if there's a surgical option to recreate the hearing. For the younger patient population with the conductive hearing loss problem, that tends to be a preference as opposed to wearing a hearing aid. In terms of the older population, in terms of procedures available, really the hearing has to be pretty poor for you to qualify for something called a cochlear implant. And that also is not a very discrete way of amplifying the hearing. So, you know, the hearing has to be extremely poor and you fail a hearing aid use, you can be a candidate for cochlear implantation. But again, the selection criteria to fit into that category is a little bit smaller.
So actually, I wanted to touch over this earlier when we were talking about hearing aids. For a person who's choosing or is in need of a hearing aid and
Yes.
choosing one,
Yes.
how would they know which one is more appropriate for them, for their age, for their hearing, and such?
Well, I liken it to a little bit like buying a car. Not everybody needs a high-end car, and not everybody needs a low-end car for their needs. You know, the patients of mine who are professional musicians obviously require a much more high-end hearing aid than a patient with limited use of their hands, who's, you know, not so functional and just needs, you know, something so they could hear somebody speaking to them. So my advice when this is going on is to get your hearing test, figure out kind of what the dynamics of the hearing is and your functional needs. And once you kind of have an idea of that, you sit with a hearing aid specialist at a hearing aid dispensary and kind of discuss all the different options available to you for your needs. Because there's a plethora of types of hearing aids, and there's also a very wide range of what different insurances will cover. In terms of the hearing aids. And you have to kind of figure out what's right for you. So sitting with a hearing aid specialist that's kind of customer service oriented is always a good idea.
So in regards to people complaining of pressure and elevation when they're, for example, on a plane, with the elevation of the plane and their ears popping, and they come to you and they tell you, I can't fly a plane. I want to go here. I want to go there. I want to go to Egypt, but I can't take the pressure of the plane.
Right.
So, what is causing this this ear pain and pressure that's not making them enjoy their travels?
So typically, what's happening with the change of air pressure is that your ear is trying to adjust, okay, to the different density of the air. Normally what happens is we have something called the eustachian tube, and I could show it to you in our model. It connects into the nose, okay? So this tube actually is your eustachian tube, and it's actually connected to your ear. And this is like a valve that opens and closes to equalize pressure. When that's not working 100%, or there's a dramatic change that the body has to adapt to, you tend to feel this pressure popping, and it can actually be quite painful for some people. So what you want to make sure is that this tube is functioning as optimally as possible and is healthy when you're flying. So if you have a tendency towards ear clogging, like I said, sometimes a healthy nose gets a healthy ear. So decongestants that help open up that tube tend to help. Again, not for routine use. You have to keep in mind what medical problems you have. But if you take a decongestant, like the medications we mentioned previously, within 30 minutes of the flight, that tends to help. If your flight is, for example, America to Egypt, and it's longer than 6 hours, you might need to take a second dose before you land, because the descent is usually actually the more uncomfortable part of the flight. In addition to that, there's mechanical things you can do to open up the tube. For babies or kids, I tell the parents to have them have the bottle or suck on a pacifier, because that swallowing motion opens up the tube. For adults, you can chew gum, or even holding your nose, pinching your nose and swallowing tends to open up the valve and help the ears to pop. The sensation can last even after you get off the plane, but if you keep doing those things, it tends to help you recover more quickly.
Thank you, Dr. Heidi. Pleasure to have you.
Thank you again for having me.
We hope you enjoyed our episode today on CYC MD, and we answered many of your questions regarding the ears. Until next time, have a blessed day.